Your heart beats about 100,000 times a day. And most of the time, it does its job so quietly you never think about it. But sometimes it tries to warn you. Small signals. Easy to miss, easy to ignore. And that's exactly what makes them dangerous. Today, we're going to walk through 5 warning signs of heart disease. Signs your body may already be showing you, right now. This isn't here to scare you. It's here to help you actually notice what your heart has been trying to say. Let's start with the one most people already know, but often get wrong. Number 1, chest discomfort. Most people picture a heart attack as sudden, dramatic pain that drops someone to the floor, but in real life, it's often quieter than that. It can feel like pressure, like squeezing, like fullness right in the center of your chest. It might last a few minutes. It might fade and come back. And here's what many people don't realize. It doesn't always feel like pain at all. Sometimes it just feels like heaviness. Something sitting on your chest. If that feeling shows up and you can't explain it, it deserves attention. But chest discomfort isn't the only clue, and this is where things become important. Number 2, shortness of breath. This one is sneaky because it can happen with no chest pain at all. Maybe you're climbing stairs you normally climb with ease, and suddenly you're out of breath. Maybe it happens even while you're resting. On its own, it could be many things. But when it shows up alongside fatigue or chest discomfort, it becomes a signal worth listening to. Number 3, and this one surprises a lot of people. Pain that shows up somewhere other than your chest. Discomfort can travel to your arms, your jaw, your neck, your back, even your upper stomach. Some people describe it as feeling like indigestion. It's easy to explain away. But according to the American Heart Association, this kind of spreading discomfort is one of the classic warning signs your body can give. And it's often overlooked simply because we don't expect heart trouble to show up outside the chest. Now here's a sign that's often dismissed as just being tired. Number 4, unusual fatigue combined with something else. A sudden cold sweat, nausea, lightheadedness. On their own, any one of these could mean almost anything. But when fatigue feels extreme, the kind that makes climbing a few stairs feel like a workout, and it's paired with a cold sweat or nausea, that combination matters. This pattern shows up more often in women, and it's one of the most commonly missed warning signs because it doesn't look like the movie version of a heart attack. And the final sign is one people rarely connect to the heart at all. Number 5, swelling in your legs, your ankles, or your feet. This can be a sign your heart isn't pumping as efficiently as it should, causing fluid to build up in your body. If you also notice a persistent cough or a racing or irregular heartbeat, those are worth paying attention to as well. None of these signs alone means something is definitely wrong. But together, or repeated, they're your body asking you to check in. So here's the takeaway. You don't need to panic over every ache or tired afternoon, but you do need to listen. If you notice these signs, especially more than one, especially together, especially if they're new, talk to a doctor.
Get it checked.
Not because something is definitely wrong, but because catching a warning sign early is one of the most powerful things you can do for your heart. Your heart doesn't get a second chance to warn you forever. So the next time it speaks, make sure you're listening. If this helped you understand your body a little better, consider following for more health awareness content and share this with someone who needs to hear it today.